what happens if you do have a problem over the holidays. So let's say that that's when your seizures act up either because of all the things we've talked about or because they just decide to act up at that time anyway. Well, hopefully you have a relationship with your doctor's office that you can act on that and address your seizures. But in particular, I want to turn to some new treatments for addressing seizure exacerbations. That means seizures that are suddenly worse, or seizure clusters. So seizure clusters are when seizures occur one right after the other. They could occur every few minutes, they could occur every few hours, or even over a few days. And so for some people, they only have their seizures in clusters. So for example, they might have a seizure, 3 seizures all in a row in one day, and then not have them again for another week or 2 or 3. And when they have them, they're going to have 3 seizures again, as opposed to having 1 seizure here and 1 seizure there. Now, most people with epilepsy have just a single seizure at a time, but almost everyone has a cluster at one time or another. And of course, some people have only clusters. The unique thing about clusters is that once they occur, if you know that that's what's going to happen, you have an opportunity to intervene, to stop, to do something to prevent the next seizure. And those are seizure abortive therapies, also called sometimes rescue medication, because the idea is you're going to do something now to prevent the next seizure. That's different than one long ongoing seizure, something called status epilepticus, which is a medical emergency. So one long seizure that goes on for more than 5 minutes needs medical attention through the EMS, the emergency medical system, calling a rescue squad, that kind of thing. But we're talking about someone who regularly has seizures that occur in clusters, also called acute repetitive seizures sometimes. So we have a couple of things to consider about medications to treat clusters, to stop the cluster. The most common kind of medication that we use are benzodiazepines. That's a whole class of medication. It's not just one drug, but a whole class of them. And there are a couple that are widely known. Diazepam or Valium is a drug that's widely known not just for clusters, but for other reasons. And it comes in a pill form, has long come in a pill form that helps to prevent clusters, for instance. Lorazepam or Ativan is also, Ativan's the brand name, is also a drug that you could take as a pill that could abort clusters, and that's also been known for a long time. But the problem with a pill, like clonazepam or Klonopin, another drug, the problem with a pill is you have to be able to be alert enough to swallow it and not choke on it and cooperate enough. So if the seizure renders someone confused or sleepy or unable to cooperate, or they're so frequent that they can't wake up in between and participate, then that's a problem. The second problem is that when you swallow a pill, it then has to dissolve, be absorbed into the stomach and the bloodstream, and then make its way to the brain. And that takes a while. For most of these drugs, it takes between 30 minutes and an hour or 2. So if the clusters come very frequently and you can't wait that long, that's also a potential problem. So about 15 or 20 years ago, rectal diazepam, called Diastat, was approved for the treatment of clusters. And this is a medicine that's administered into the bottom, into the rectum. And it's squirted into the rectum and absorbed in there, and because it's absorbed there, it's more rapidly absorbed. And that has the great advantage, first, of being able to be absorbed rapidly, so it kicks in about 7 to 15 minutes, and also has the advantage that people don't really have to participate. Now, you can imagine the problem with this is sort of obvious, because they have to cooperate to some degree if you're administering a medicine in their bottom. And if they're thrashing around and having intermittent seizures, that can be a problem. It takes a little while to get everything together and administer it, and it's pretty cumbersome. Somewhat unpleasant for the person administering it and for the person receiving it. So consequently, new drugs have been developed to abort seizure clusters. And just in the past year or 2, there have been new medicines that are administered intranasal, meaning up the nose, so a squirt up the nose, and that seems much simpler, doesn't it? So intranasal midazolam with the brand name Nasolam, and intranasal diazepam with the brand name Valtoco is available. There's also a dissolvable film of clobazam, which is a different medicine, and that doesn't require as much cooperation, but it still is in the mouth and has to be absorbed. So among these 2 intranasal drugs, the great thing about them is it doesn't require any cooperation from the person. It could just be squirted right up their nose in one squirt. The really important thing to recognize about these medications, though, is they're very potent. They're powerful. So the directions have to be followed appropriately so that you don't give someone too much medication. And it's important to recognize that these medicines are useful for intermittent seizures. They can be given for ongoing seizures, and in some situations they would be effective and useful for that, have even been studied or shown to be effective in that situation, but their intended use is for seizure clusters.